All right, let's talk about something super common, but also, let's be honest, kind of confusing. Those little bumps on your skin. Today, we're zooming in on two that get mistaken for each other all the time: flat warts and skin tags. So, what's the real story here? Let's get into it.
You know that moment, right? You're just going about your day, you feel something on your skin, and wait a minute, what is that? That little bump definitely wasn't there last week. And your mind immediately starts racing. Is it a spot, a new mole, or could it be one of two other possibilities that look surprisingly similar?
So, if you've ever felt a little stumped trying to figure it out, guess what? You are in very, very good company. Skincare professionals say this happens constantly. People walk in totally convinced they have one thing, when it's actually the other. The good news is we're about to clear up that confusion for good. Okay, so let's bring in our two main suspects for a little side-by-side comparison. In one corner, we have the flatwort, and in the other, the skin tag. Now, at a quick glance, you can see why they get mixed up. But as you're about to find out where they come from, well, that's a completely different story. Okay, first up, the flatwort. And the big keyword I want you to remember here is viral. This isn't just your skin doing something random. A flatwort is actually a tiny infection caused by a virus, specifically the human papillomavirus, or HPV. So think of it less like a bump and more like a tiny unwanted guest that's decided to move into your skin.
And then we have our second suspect, the skin tag. You might hear a doctor call it a soft fibroma. Now, unlike the wart, this is not some kind of outside invader. A skin tag is just a harmless little overgrowth of your own skin. It's made of your own cells and collagen that just grew a little extra. So it's less of a trespasser and more of a quirky little resident.
And really, this difference right here, a virus versus your own skin's overgrowth, is the absolute key to everything. Because why they appear in the first place determines all the other differences between them. So this is where their stories totally diverge. A flatwort is triggered by an external force, that HPV virus. It often pops up when your immune system is a little bit down, giving the virus an opening to take hold. But skin tags, that's an inside job. They're usually caused by things like simple friction, where skin rubs against skin, or by internal factors like aging, hormonal changes in pregnancy, or conditions like obesity and diabetes. And that brings us to the most critical difference of all, the contagion question. Can you spread them? For flatworts, since they're viral, the answer is a big yes. They are contagious. You can spread them to other parts of your own body just by scratching, and you could pass them to other people. Skin tags, on the other hand, are not contagious, not at all. If you start seeing more of them, it's not because they're spreading, it's just your body deciding to make a few new ones. Okay, so now that we know why they show up, let's talk about how to tell them apart just by looking. Time to put on our detective hats. Here's a quick visual field guide. Let's break down 3 telltale signs. First up, let's talk shape. A flatwort pretty much lives up to its name. It's usually flat on top, kind of like a tiny little pinhead or a grain of sand on your skin. A skin tag is the opposite. It's soft, it protrudes, and sometimes it even hangs off a little fleshy stalk. Then there's location. Flatworts often show up on the face, think forehead, cheeks, and the neck. Skin tags, though, love areas where there's friction. So think skin folds, like the neck, eyelids, armpits, and the groin area. So at this point, you might be thinking, okay, that's interesting, but really, I just want it gone. And I get that. But getting the diagnosis right is absolutely crucial, because the reason why you treat them and how you treat them is worlds apart. And this is the fundamental split in the road. When you're dealing with a flatwort, the goal is medical. You have to get rid of the underlying virus to stop it from coming back or spreading to new spots. But for skin tag, the goal is purely cosmetic. The removal is totally optional, and it's only done if you don't like the way it looks. And because the goals are different, well, the removal methods are different too. Treating a wart might involve things like freezing it off, using lasers, or applying topical medications that are all designed to attack those virus-infected cells. Removing a skin tag is way more straightforward. It's often a really quick, simple procedure with a laser or even just sterile surgical scissors. So let's just hammer this point home. When it comes to risk,
How many skin tags out there absolutely must be removed for health reasons? How many of them pose any kind of medical threat? The answer is this big number right here. 0. Nada. They are completely and totally benign. Getting rid of them is a choice, never a medical necessity.
So, we've gone through the cause, the look, the treatment. It's a lot of information. But all of it really points to one single, most important takeaway. It all comes down to what you should do next. Look, an explainer like this is fantastic for helping you make a really educated guess. But, and this is a big but, it can never ever replace a real diagnosis from a professional. If you have any new or changing spot on your skin, the only way to be 100% sure what it is, and more importantly, how to treat it correctly, is to see a dermatologist. Ultimately, knowing for sure what's going on with your own skin is a perfect reminder of how getting clear, precise information is just so critical for making good health decisions. And it kind of makes you wonder, doesn't it? What other common health mix-ups out there should we all probably be a little more aware of? Thanks for tuning in.